There we go. Thank you for the reminder. Uh, Good morning, everyone. Thanks for being with us. We're very pleased to be able to present this webinar full of information. I'm Ann Katz. I'm Director of Arts Wisconsin, the state's community cultural development organization, and we're presenting this webinar in partnership with the Wisconsin Arts Board. Karen, please introduce yourself.
Hi, I'm Karen Geschko, the Assistant Director at the Wisconsin Arts Board, and really glad to be able to have this conversation yet in January of 2021.
Right, exactly. So we are going to be hearing from Dr. Laura Cassidy, who is with the Medical College of Wisconsin. And I'm just going to give a little housekeeping, and then I'm going to introduce Kendra Ingram, president of the Marcus Center, who is going to introduce Laura. You're all muted because it's a webinar. If you have, we have a few questions that we're going to start off with after Laura's presentation. And then after that, we will have more time for more questions. You can either put them in the Q&A box or the chat box, and we will monitor those and answer them as we can. And I'm sure there'll be more questions than we have time for. And I think we'll have some kind of FAQ thing set up on our website so that we can keep answering your questions. At the end of the session, Kendra is going to talk about the shuttered venue operators grant, which used to be known as Save Our Stages. And she's going to give some updates from the SBA, which came out tomorrow. So with that, I think we're all set. I'm very pleased to introduce Kendra Ingram, president of the Marcus Center for the Performing Arts in Milwaukee, who has been in Milwaukee for just over a year?
It's coming up on the end of my 10th month.
Okay, not even a year. And wow, you just started at the right time, Kendra.
Right?
We're so glad you came to Wisconsin. Kendra introduced us to Dr. Laura Cassidy, which we're really thrilled about, and said that she had been updating people in Milwaukee and thought that her information would be great for the state. So with that, and we agree. So with that, Kendra, thanks for being with us. Please introduce Laura and take it away.
Sounds great. So hello, everyone. Good morning from Milwaukee. We have been, like many of you at the Marcus Center, contemplating reopening plans and protocols probably as early as May of 2020. If we remember back to April, we had all been closed for a couple of weeks at that point. Many of us had received our PPP loans. And I was just talking to someone yesterday. We were still thinking back then that we were going to open in the fall. Someone was like, oh yeah, remember those days when we thought we were going to open in the fall of 2020? So what happened was a lot of venues, fast and furious, started to put together reopening protocols, safety plans. And I had been introduced to Dr. John Raymond, who's president and CEO of Medical College of Wisconsin, who had been doing a lot of these information sessions for the local chamber and had been advising the governor. He's kind of like our own, as I put Dr. Laura in this category too, our own local Dr. Fauci's. And he said, the person you really want to talk to is Laura Cassidy. So Dr. Laura Cassidy, you've probably seen her bio already through the introduction that came out with this invite. But Dr. Laura has been truly our Dr. Fauci for the region, consulting and advising all of the performing arts, the restaurant industry, and a number of other industries on how to safely navigate operating in a time of COVID. So we've been talking to Dr. Laura since back in June, Laura, can you believe it? And now Laura has become a real true, part of our community and a fixture in our weekly and monthly conversations about COVID preparedness and public health. So with that, I'm going to turn it over to Dr. Laura, who is going to talk us through from soup to nuts, a lot of the questions that you may have about how to operate in these times. Thank you, Dr. Laura. I turn it to you.
Thank you so much, Kendra, and I'm delighted to be here. And I must say, it's been a really great experience working with the performing arts, and I think I learn as much from you as you do from me. It's a true partnership. Oops, now if I can only figure out how to advance my, there we go. So this morning I have some slides I'm going to present, and I'll go through them pretty quickly because I think it's more important for us to have a conversation. I'm going to highlight some of the things we talk about currently, and then I think, having a dialogue so I can hear what you need to know, and I'll do my best to answer your questions. And if I'm not sure of the answer, then afterward I will find somebody or some information and do my best to answer any remaining questions. I'm going to start by talking a little bit about vaccines and distribution because that's the hot topic, and then get into some things that are more relevant to, not more relevant, but specific to the performing arts. And this Mask Up billboard, and from the Milwaukee Ballet shared it with us. They're putting it up, and I just thought it was beautiful. So I got her permission to put it on the slides. So I think most people are aware that the Pfizer and the Moderna vaccine are now authorized for emergency use and being rolled out. And there's multiple others in the pipeline. I just learned that by the end of February, Johnson & Johnson will likely apply for emergency use authorization. So that'll be really good. The Pfizer vaccine has to be stored at extremely cold temperatures, so it's fragile. It's more of a challenge to handle and transport. And if a vial's open, it has to be used. So there's a lot of coordination involved with giving that one. Moderna needs to be kept in a freezer, but not a special freezer. And so it's not quite as fragile. And so that's used a little more in the rural areas or getting out into areas that may not have this expensive equipment to store it. So that's one of the reasons it may seem like it's taking a little while to get started up, because it's a big operation to protect these vaccines, to use them appropriately, to train sites to give them, and to store them appropriately. Now, when Johnson & Johnson comes out and AstraZeneca and some of the others, those are more like our flu vaccine that can be given at any pharmacy. People are used to how to use them. And so that will be rolled out, I think, rather quickly when that starts. And then I think everyone has heard phase 1A, B, C, 2. Someday we'll get to Z. But the logic behind it was that in phase 1A, we knew it would take us a little time to get up and running, but we wanted to protect our healthcare workers. So we wanted to make sure they got vaccinated so that they remain healthy and they can take care of us. And we also wanted to vaccinate those in long-term healthcare facilities and those who work there, because they've had some of the highest impacts and highest number of deaths. So we want to prevent deaths, keep our healthcare workers safe. And then we started rolling it out to more frontline personnel, because they are actually on the front line, have high risk of exposure. We can't function in society without them. So we want to protect them. And then this week, we started rolling it out to those 65 and older, because they're at higher risk. So that's what's happening now. That's called phase 1B. And then in March, we'll include others in that frontline personnel. And it's sort of a moving target every day who's considered frontline personnel. And, but they will be defining that, and we'll see what happens. One day we'll get a message that these are the people eligible, but also those with high risk medical conditions, because they're at risk for more severe disease and death. So the first goal is to protect our healthcare workers, get our rates of hospitalizations and deaths down. And then in spring, summer, we'll open it to the general population so we can then reduce transmission. So I think that's the logic behind it. And I know people are going to ask, I think probably by April we'll be in phase 2, but that could change. And if some of these other vaccines get emergency use authorization, that could change quickly too. The current vaccines are very safe, very effective. People are concerned because they were rolled out so quickly, but we had the platforms and the science in place, and people have been working on these type of mRNA vaccines for years. For, they might help with cancer treatments and things. So the technology and knowledge was there, And then the government's, invested billions of dollars so that everybody across the world worked together like never before. Resources were poured into this, and they did things simultaneously and even started producing the vaccine before it was approved, which was a big risk just in case. So I want to assure people that it is very safe. Of the millions and millions of people who have gotten the vaccine so far, there's been a few that have had allergic reactions, but those are people who generally have bad allergic reactions anyway and carry EpiPens, and we can handle that. So the benefit to getting the vaccine far outweighs any risk to getting it. And it's basically a shot in your upper arm. And when it's your turn to get the vaccine, just be aware, you've probably heard this, but you can have some symptoms from the vaccine, especially the second dose. You might feel a little tired. Few people have fevers. You might be achy. And so don't worry if this happens. You cannot get COVID-19 from the vaccine. There's no live virus in it. What this is your body responding and saying, I'm going to fight this COVID molecule if it comes into my body. If I see that virus, I will fight it. So it's building up its little army inside of you. And it does take time to build immunity. So when you get the first shot, you're not automatically immune. It's teaching and training the system. So it takes time to reach that high level of immunity. And the other thing is people say, how will people know I had the vaccine? So when you go in to your, get your vaccine, you'll fill out a brief health form, and they'll screen to see if you might be at risk of a allergic reaction. And then you get in the bottom corner of the screen, you get a vaccination card. And I do a lot of work in Africa. And whenever I go to Uganda and some other African countries, I have to show my CDC vaccination card that shows I have a yellow fever vaccine, because they will not allow me into the country unless I've had that. And plus, I don't want to get yellow fever or any of the things. I've had so many vaccines you wouldn't believe. And anyway, and then you can also sign up for this VSafe, which is a health tracker. It's run by the CDC. And my husband's a physician at Children's Hospital, so he's gotten both vaccines. And so I follow him around and watch all this. But with this VSafe Vaccinator app, what it does is once a week, it'll check in with you and say, how are you doing? And you put a little smiley face in for good or frowny face, and you tell them how you're feeling. That way they can track on a large scale level if anybody's having any symptoms. It's completely confidential, completely optional, but it's kind of a nice thing to do. Plus it's a proof that you had the vaccine. And then you probably hear in the news, they talk a lot about herd immunity, and we need to get to herd immunity before we can go back to normal. And so I just wanted to talk a little bit about that, because the term can be a little bit misleading. We say we want 70 to 85% of the people to get vaccinated to get to that herd immunity. But if I get the vaccine and I'm immune, it doesn't mean like the immunity spreads to you. What it means is that the virus can't get through me to you. And so that's where if most of the people are vaccinated, the virus kind of dies out because it can't spread quickly. And with COVID-19, nobody was immune. We'd never seen this virus before. So that's why it became a pandemic so quickly, because everybody was susceptible. You could find a host anywhere to live, to mutate, to move on. And so that's why it's important that we get vaccinated and not give it a home. So I think everybody has heard how it's transmitted through airborne droplets that come out of our respiratory system, which is highly relevant to singing, wind instruments, different types of performances where you're speaking loudly and droplets might go out. And there is scientific evidence that the further away you stand, the less likely the droplets will get to you. So there's large droplets that drop faster, small ones, and then the real tiny airborne ones that can shoot further. And as you can see, the further away you are from somebody, the lower your risk of infection. So that is the science behind social distancing. But then if you put a mask on, that's even better, because the droplets can't go anywhere. So in this little picture, you see we have the infected person in the pink shirt on the top not wearing a mask, and a healthy person is wearing the mask, but the healthy person still has a 70% chance of getting COVID from that person if they come in close contact and talk. In the second one, if the infected person wears the mask and the healthy person doesn't, the risk goes way down to 5%. So this is why they say the masks prevent you from spreading it, but it also does provide some protection to you. And if you both are wearing a mask, the risk goes way down to 1.5%. So the other things that go into it is the time of interaction and the type of air quality. So if you're wearing a mask and you're staying 6 feet apart, that's pretty safe. The longer you're together, the more chance you might have strong enough dose to get ill. If you have good airflow, that helps. And again, hand washing and sanitation is important. And so this is why when we talk about being outside, it's better because the droplets don't linger in the air. So when we think about indoor and outdoor performances, the first thing you want to do is check with your local health department to see what their guidelines are. Now in Milwaukee, we've been very strict and we've had the mask mandate longest. We also have a high population density and we had a high rate of COVID. But now, you know, it went uncontrolled. So it's really all over the state. COVID is everywhere. And it's spreading uncontrolled. There's these new strains out that are much more contagious. All the evidence suggests that the vaccines will be effective against them, and masks and distancing and all the usual stuff works, but it is much more contagious, these new strains. So in Milwaukee, we've worked with the health department to come up with the safety guidelines like Kendra was mentioning and come to an agreement, you know, what is reasonable for performances and what is also safe. And so I had worked with the health department too for restaurants on this. And if they had an approved safety plan, they could function at a higher capacity than some of the other restaurants. And so the health department with the current surge had set the capacity at 25%, which you can think if it's a small theater, if you have 100 seats and you can only have 25 people, is it even worth it? And so then we started saying, well, is it really capacity? Some of these theaters are quite big, or is it just being able to stay 6 feet apart? So if you come with a group, you can sit together, but then you really should be 6 feet apart from the others. So now they're working to change those guidelines. Outdoor performances are safer because you're outside in the fresh air and the droplets don't linger. Inside, there are special filters and systems you can put in to help remove the viruses and circulate the air. And the performers should still wear masks and maintain 6 feet distances as much as possible. Wind instruments and singing are a big deal. And the CDC recommendations are, you know, you should have at least 10 feet between performers and at least 25 feet between the performers and the first row of audiences. With wind instruments, you really want to be careful because, as you know, they're blowing further. And they also said you can't just put plexiglass because I guess the droplets can go up and over. Excuse me. So then the big question is, how does this end? When can we get back to normal? And, you know, with SARS and other epidemics, we're able to diagnose cases, isolate infected patients, excuse me, do the tracing to their contacts and stop the spread. Well, this has gotten so out of control, it's difficult to even contact trace anymore. So, you know, the key right now is our general public health measures and also vaccination. Once we get up to 80% of the population vaccinated and the rate in the community is low, then we can be comfortable, I think, you know, with our normal gatherings. And I don't think really it's an all or nothing thing. It's a gradual thing. We can't vaccinate everybody in one day, but what we're going to see as the vaccines roll out, we'll start to see, I mean, this is what we hope, hospitalizations and deaths go down because we're vaccinating the most vulnerable people. And then we'll start to see the rates in the general community go down. And that means it's working. And that means we're in the right direction. So as it starts going down, I think things will gradually start opening up. We did some last, you know, sort of crude calculations about the number of people getting vaccinated. And our highest number in the state was 24,000 vaccines. And if we look at 80% of the adults in the state, if we can double that and do 47,000 vaccines a day, and everybody accepted the vaccines and we had enough vaccines, we could potentially get to that point by the end of June. Now that's best case scenario, but you know, I mean, this is what we have to think about, you know, it's important. So I am going to open it up to questions now because that's just an overview and I'm sure you have a lot of interesting questions.
And thank you, Dr. Laura. And I think it would be easier, everyone, if you could put your questions in the Q&A just so we can make sure that we capture all of them. So yeah, if you want to, if you want to ask a question, please put in the Q&A. And Anne, I think we'll start with the pre questions.
Yeah.
That came.
Thank you, Kendra, and thank you, Dr. Laura, for that, a lot of information in a small amount of time. Thank you for being so thorough and concise. So we did get a few questions before this started, and we'll work on those first, and then we'll get to the ones that are on the screen. So the first question is, what are recommendations for best practices for small and low budget theaters that want to be safe, working in, for example, black box 99 seat spaces? And what are recommendations for these kinds of theaters who share space, which happens at universities and in other places? So basically, we're talking about small theaters, open spaces, the black box theaters that are small spaces, open spaces.
Thank you. So I did put together a checklist for the performing arts that, I could share with everybody, that just has the categories of things to think about and some links to good information and accurate information. And again, first check with your local health department and see if they have any guidelines or restrictions. But in general, you want people to maintain that 6-foot distance. You want everybody to be masked during the performance. You want to be diligent about sanitation between shows, having people come in one way and leave one way so they're not interacting. They're recommending not to have intermissions where people mingle or serve beverages and food where people have to take off their masks. As far as the performers, depending on the type of performance, they just may have to interact more than you would like. So that's why educating and communicating with them about the importance of safety, even outside of the performance, what they do in their personal life, so they don't get exposed and bring it into the theater. And then when vaccines are available, I recommend everybody get a vaccine. So there's a lot of things you can consider. Now, if you're sharing the space with a university, I think you'd have to check with their rules and regulations as well. And then also staggering performances is good. Some people are, if staggering, like when they get the ticket, maybe they come in at an allotted time. But if it's a small theater with 100 seats, you might not have that many people attending.
Okay, and again, thank you. And again, we'll have these questions and the answers and that checklist. We definitely want that checklist, which you may have put in the chat box, Kendra. But thank you for that. So along those lines of guidance, if you were going to rank the importance of guidance from the various sources, how would you rank them at this moment in time? In other words, should event organizers pay more attention to the CDC, local public health agencies, the state public health? Is there any order to this?
Yeah, well, it kind of depends on where you are. In general, the CDC is the gold standard, and the states and the local health departments follow the CDC guidelines. And so, I generally go there if I have questions about information, but different localities are imposing different restrictions or none. So if you live somewhere where they don't have a limit on capacity, you still might want to follow the CDC guidelines to keep your patrons and your performers safe. They should be fairly consistent unless there's something unique to the area that you live in. And sometimes there's a case where, a certain area has a surge. And so they might enforce stricter policies to get it under control. Or there might be cases where the community rate is low and they loosen up a little. So it's kind of a balance between the two. But in general, I think you kind of have to follow your local guidance. I would always take the most conservative measure, I think.
Okay. Thank you for that. I don't know if you can answer this one. Given that the legislature is discussing the mask mandate, and it's uncertain what's going to happen with that, but if the mandate is overturned, do art centers, theaters have any recourse if someone comes in and refuses to wear a mask?
This was a big controversy when I first started working with restaurants in Milwaukee City, because they were saying nobody will ever wear a mask. This is going to be like a disaster. And, I said, well, you got to do the right thing. If people don't wear masks, you'll have an outbreak and you'll close. So you can require people to wear a mask. And if they don't, you can guide them out. So then people were worried that they were going to need to hire bouncers and people were going to get upset. And I mean, I think we've all seen that people have turned airplanes around and kicked people off airlines. But I think there's ways to de-escalate it. And, you know, it's become such a controversy. And I think I'm hoping we're getting through that. But, you know, I know that some places have gone through like emotional intelligence training. And, you know, I mean, the hope is that if somebody refuses to wear a mask, you say, look, you know, we'd like to invite you back another time when it's safer. We need to keep everybody safe. And hopefully it doesn't escalate.
I would agree with that. And I can say that this has also been a huge topic of discussion at some of our national tables for Association of Performing Arts Professionals, the Performing Arts Center Consortium, National Independent Venue Association. And the consensus is, well, first of all, you absolutely can require individuals to wear masks in your venue. And the thing is, you do have to make sure they know in advance. One of the things we've actually talked about when we start coming back to indoor performances is having signage in the garage so that people know even before they get to the entrance of the building, you know, masks are required in order to enter the building. Putting it on the ticketing page before someone presses purchase, and also, you know, very clearly outline it. Kind of, it's like your disclaimer that we all have that says programs and dates and times are subject to change, so that if an artist cancels or changes, you know, you're covered. And I think it's the same with the masking. Like, as long as you're telling people up front that this is what's required, I think you're absolutely within your right to require masking. And I can say in Milwaukee, all of the venues are going to require this. We have banded together to ensure that people, it's not just a Marcus Center thing or a Pabst Theater Group thing. It's a pretty much any venue you can expect you're going to have to wear a mask. So if that's helpful.
Yeah, those are really good points about communicating expectations. And we, like Kendra said, we've had a lot of conversations that if everywhere you go, you have the same expectation, then it modifies human behavior and it's not a big deal.
Thank you for that. Those are the questions that we had in advance. Kendra, do you want to go through these or should I read them? I could read them. I'll start reading the questions that have come in, or do you want to do it?
Happy to do that. And some of these Laura and I may take together as well. First one, Laura, is for you. How useful are the whole building ionization air purification systems? I know this is also a big topic of discussion, so I can weigh in on this one.
Yeah, I'll let you weigh in. I will say I know that there are specific air filtration systems that are very good and highly recommended. Kendra, you probably know more about what type.
Sure. So one of the systems that is being used by a lot of venues or being installed by a lot of venues right now is the Global Plasma Solutions, which is an ionization system that I think attaches to your current HVAC. I will tell you, as I've done a lot of research into this for my own venue, it is not inexpensive, but it is largely, the cost is largely associated with the size of your venue and operating system. So it is worth looking into. I'm going to put the link in the chat. I can tell you also that Milwaukee County public facilities are planning to install this in all of their large facilities like the courthouses and whatnot. So we actually got a complimentary evaluation of our venue because we are a county facility for that system. And I know a number of colleagues who've already, performing arts centers who've already used it. So it is somewhat accepted in the industry. There are others, and you could do some research on that. But I would say, Andy, that it is definitely worth looking into. If depending on our COVID relief funding over the next few months, we will be installing it in our facility. Galen asked, do performances outside still require performers to be 10 feet apart? Laura.
Okay. I think that, so when we say required versus recommended, that's one thing. And I would say probably 6 feet apart is good, but it depends on the duration of the performance and type of performance. I think with wind instruments, you still want to be really careful. But if it's like a, piano and others are acting, sometimes there's going to be interactions. So I guess what I'm trying to say is it depends on if it's stationary or people move about also. I don't know how helpful that is, but
yeah, I think that's good answer. And Andy just put in the chat, as a measure of cost, his venue installed global plasma. Great. So yeah, so you're aware of global plasma. Yeah, and at $29,000 for 40,000 square foot facility. Yeah, for our facility, it's going to be closer to a 6-figure number. But again, it's a tried and true and well-tested system. Next question is from Sarah. She says, you mentioned a resources section coming up. Will it include direction, advice about air filters, air handling, et cetera, et cetera. I think the best resource for that, or the best place to go for venue specific, would be the International Association of Venue Management website, which I did put in the chat as well, IAVM. Yeah. They have a lot of great resources. And actually, there's ways that you can, now is the great time to become a member of service organizations, because particularly service organizations like this have a lot of resources for its members, guidance, also can connect you with people who may be similar to you that are doing these kinds of installations. So I would definitely look at IAVM for that. I also put, I'm sorry, go ahead, Laura.
I was just going to say that, we have resources already listed, and we'll just keep updating as we get more information. So I'm going to get all those links from you, Kendra, but
excellent.
Go ahead, sorry.
Great. The other one I put in the chat was Association of Performing Arts Professionals. They're not quite as venue specific, but they have an interesting mix of resources for both indoor and outdoor performances, and as well as information on relief funding options, et cetera, et cetera. As I know, Arts Wisconsin and the Arts Board do as well. So Brian asked, for theaters who perform in the summer exclusively, what are your thoughts on when you feel we may safely reopen? For Peninsula players up in Door County, I think that's Brian, right? We are considered an indoor theater by equity, but have large sides and doors which can remain open. We have no HVAC, therefore we'll be relying on natural air to exchange itself regularly. This is a really good question. I'll just from the venue perspective, I'll answer, and then Laura from the health perspective. We're planning, and I know a number of our colleagues are absolutely planning to utilize outside much more than inside this summer, even with the very optimistic idea that we will be 80% of adults immunized by the end of June, which would be amazing. Outdoor is going to be really heavily leveraged. And we feel very, very confident that outdoor capacities will be, the restrictions will lessen from the public health standpoint. I can also tell you, I was on a call the other day that our colleagues in Ohio, Cincinnati, Cleveland, Toledo, and Dayton have Lion King booked for their venues this July, indoors, full capacity. That's how confident they are. So Laura, I'd love to get your feedback on that.
Yeah, I agree. I really think by summer, if we get vaccination rates up, the vaccines will be available, and that's going to be the key. The one thing I was thinking with Door County to think about is that people come there from other areas, because I was going to say, look at your community rate, and if your community rate is low, but you also have to think if people are coming from areas where there's a higher rate. And the other thing just to keep in mind is that the vaccine's not authorized for children yet, anyone under 16. So if that affects the type of event, you'll want to think about that. I'm personally confident that if enough people take the vaccine, that by summer, we're really going to see a big difference, and we're going to be able to operate safely. And, you can think about protocols that require proof of vaccination or proof of a COVID test to come to your event.
Right.
See
And
on
that
the,
is something we're talking about.
I did see on the news last night that they have vending machines now where you can get a COVID test out and do it immediately, and it's $30. And I thought,
Wow.
voila.
Brilliant. I will also just add that I think last summer, everybody was shell shocked. We had no idea what to do, et cetera, et cetera. But this summer, I mean, assuming that things are getting better, as you've said, and people will want to do something. And so people who, organizations and centers that have never thought about outdoor things are thinking about it now, just so that you can do something. I agree. So we'll see a lot more than we did last year.
In these events where if you are maintaining some distance and you're wearing a mask and it's outside, you're pretty safe.
Yes. And I should also add, the Lion King, I saw Coco's response in the chat, like, what? Lion King, those shows will absolutely require masks. Absolutely mask wearing, and a number of other, public health protocols. So it won't just be a free-for-all. It will be the layered approach that Dr. Cassidy and others have suggested. I think Allie asked a question about advice event planners for summer events, and we've pretty much answered that. Next question.
Just follow up, because you made the comment about masks, and the one thing I didn't talk about was the confusion about whether you should wear a mask after you're vaccinated.
Yes.
So even though the vaccine's rolling out, we're still asking people to wear masks because the vaccine works inside our body to build up immunity, and you still might be able to carry the virus in your nose and spread it. And so we're studying that now. And the vaccine, prevents you from getting very sick. You might still be asymptomatic and not know it. And I mean, that's a lot better than getting sick. So until we have that data, even if you get vaccine, please wear a mask.
Yes. And again, in most of our venues, we should still be requiring it. When Dr. Fauci spoke to the Association of Performing Arts Professionals conference several weeks ago, he also gave us some very optimistic, and as we know, Dr. Fauci tends to be conservative on his projections, that we would be coming back to indoor live theater in large assembly by fall. However, he also stated the same thing that Laura just said, which is that mask wearing will still be required, and we will likely be wearing masks in theaters into early 2022. So we'll see. Question from Bridget, are you aware of any updates to the international aerosol studies as it pertains to winds and brass in instruments indoors and outdoors?
I should have done my homework before this, but you know what? I will look into that and see if I see anything. I will, if we could keep a list of these questions.
We'll put it in the FAQs.
Great. I know there have been those studies as well. I'm pretty sure I've actually seen some outcome from those studies, but to Laura's point, I don't have it off the top of my head either. Mary says, this is the first time I've seen the 25-foot recommendation between audience and performers. Can you review that and where that comes from, Laura?
Yeah, so I think that comes from if you're up on a stage, your droplets can go further and can spread further. And, as opposed to being on the same level and talking to people. So that's just a safety precaution that was put out.
Yes, and for those venues who, have opened already, like some of our colleagues in Texas and Florida who have been having indoor performances because of the loosened restrictions, almost all of them have kept the first several rows of the venue open. So no patron seating in those first several rows specifically for that reason. The other piece is we've been hearing from some of the unions is that they also want to be protected as performers. So they don't want to have rows of audience also breathing on them, even with masks on. right up close to the stage, which we know is some of our venues are the distance between audience and performer is hardly anything. So, okay. Next question. Appreciate your thoughts on how public gatherings in outdoor spaces are defined, i.e. backyard versus a concert space versus a bike rack around a half-a-mile course.
That's a great question. So I think, if it's your backyard, we still recommend you sit 6 feet apart and wear a mask. We have those recommendations for home. If you're on a bike, you're generally by yourself riding around. If you're out for a walk, you're not in a group of people. So those are generally pretty safe. What happens when it's a large public gathering is you have more people in a smaller space, and more people interacting mean there's more chance of somebody who's carrying COVID to be in that crowd and interact and share it. So I think that's one of the differences. And something that we saw that was troublesome was when things start to shut down, when we get a surge. So we have a surge, like we did in November, and things start to shut down, people start having dinner parties and they're inside. And what we saw then was it was spreading really rapidly in small personal gatherings, not as much in large spaces where, personally, I would rather go to a restaurant with an approved COVID plan than a friend's house for dinner. But people don't have that, somehow you feel safe with people, but they're the ones who give it to you.
100%. Next question. I'm not exactly sure what this question is, so I'm going to put it out to Terry and maybe she can clarify in chat while we move on. Terry says, what about performers who are vaccinated? And I'm not exactly sure what the question is. So Terry, if you want to elaborate in the chat, we're going to move on to the next question really quickly. So Tom says, prior to the 70 to 80% vaccination for an outdoor event, what are best practices? Is it similar to what we are seeing for sporting events, e.g. pod, where family groups are seated more than a radius of 6 feet apart, mask wearing, et cetera, et cetera? Yeah.
I would say yes.
Yeah.
All those practices.
Yes, and Tom, people have been doing that. Again, this is something that a lot of our southern venues who have nice weather right now have been having outdoor performances. As a matter of fact, I would send you to Dr. Phillips Center. They've been doing what they're calling their front yard concert series, and it's exactly what you're describing. They actually draw little chalk circles on the lawn, and then pods of people are, family members are sitting in the pod that are 6 feet apart. I went to an event with the Florentine Opera over the summer that was really great. That was the same thing, chalk circles of pods. One thing, a question that came up, Laura, that's related to this is regarding wearing masks at outdoor summer concerts because people will be drinking. Barbara from says, we are in central Wisconsin with many summer visitors from Chicago. Should we say masks are encouraged, but we can't enforce the requirement?
Well, I would say they're required. Now, the difficulty does come sometimes with enforcing it. And I know talking to younger people, my stepson, for example, came over and said how he'd been out at bars. And I said, well, do you wear a mask? And he said, oh, no, we just hold a drink in our hand so we don't have to wear a mask. And I said, well, get out of my house. But, like I'm an epidemiologist, your father works in the ICU. Anyway, another story. So that does become a challenge. We just hope people will behave responsibly. And somebody's got to invent a mask with a little, Velcro hole. I would sip my wine through that. I'm not ashamed.
Wasn't there a picture of someone playing the flute with that kind of hole in the mask?
Yeah, that was amazing, actually. It's a great idea. Laura, I have seen, and I would actually like to get your thoughts on this because it's related to this question. I have been at events where people were required to where they could take their mask off in their pod, but they were required to wear their mask if they left their chalk circle. Effective, not a great idea.
If they're sitting this way and watching a show, think about that. They're not face to face with somebody. where it's going to be circulated. So, I mean, it's probably okay. These are all sort of like guidelines where you just keep an eye out and you look and say, but if you're sitting in a circle or you're sitting face to face with somebody, you're more likely you're going to breathe in their droplets.
Right.
I know in restaurants, they say you don't have to wear your mask at the table, put it on when you go to the bathroom. So there's, the safer, the better, but we're humans. So.
Totally get it. Here's a really good question. I'm reading more from Dana. I'm reading more and more about wearing 2 masks instead of 1. Do we have numbers on a measurable difference or what effect that has?
So in general, any mask is better than no mask. And we know the N95 surgical masks are the best. And then we recommend you have at least 2 layers. So many masks already have 2 layers. I think if you wear 2 masks, maybe it provides more protection. I don't know if there's been any scientific studies on that. They do say that those neck gaiters, the kind that kind of hang, those are not recommended. I mean, if that's all you have, it's better than nothing, but many events and like airlines won't allow them. You have to have a mask that fits over and wear the mask over your nose and your mouth and under your chin. So that's really the main point.
Great. Here's another question on air handling from Gerald. If you're exchanging the air in your audience chamber 4 to 5 times per hour, is there really an advantage to using an ionization system or an ultraviolet system? That is a good question. I know this is a conversation that has also come up among the venues. I think it depends. And again, I'm not an expert. Laura, feel free to, I know air handling is not your area either, but I think it has really depended on the size of your venue. So if you're a very small venue where there's going to be tighter quarters, that might having an ionization system would actually be a benefit. Larger spaces where the air is more dispersed, at least from what the conversations have been, it may or may not be as advantageous. I can tell you that most venues have been moving away from the ultraviolet system, just because, again, for large venues, it's really, or even smaller theater venues, it's not quite as effective as the ionization system, which is capturing the air as it's going, going through your HVAC, rather than once it gets into the building and then capturing the ultraviolet system from the ceiling. So I'm not an expert. Anne and Karen have heard me say this many times when it comes to the Save Our Stages as well. But that's definitely one of those IAVM questions you're going to want to get with an expert from venue management on that. But good question. Next question is from Jeremy. He says, as a follow-up to the question about aerosols and wind instruments, can you recommend any suppliers of risk mitigation kits? For example, specialized face masks, instrument bell covers, instrument bags.
That is not something I've looked into. Have you heard of that from any of your partners, Kendra?
I can say that university schools of music have been looking into this. I know specifically my colleague at University of Maryland, their students have been experimenting with these specialized face masks and instrument-specific masks. But I would say to check with some of the larger schools of music who have been able to come back. They've actually come back for instruction with music instruction before a lot of us have come back with live performance. So, which I was kind of blown away with. I saw an example that University of Maryland put out of a performance with their wind ensemble. It was outside, but they were all wearing these funky masks, kind of like the one, Laura, that you showed in the picture with the wind instruments. Brass players were playing through like a little opening, and it looks like Bridget says she can send Anne some sources for wind instrument covers and bags. Great, that would be great, Bridget. Thank you. But yeah, I would definitely check with some of the large music schools, collegiate music schools, because they're really I feel like the ones that are on the front edge of this technology. Aerosol studies update. Oh, great. Diana just shared with us, and I'm going to copy this and paste it in the link. Aerosol study update as of mid-December. Thank you, Diana, for that. Really appreciate it.
Terry answered your question about the performers and vaccinations. If you want to answer that one.
Oh, yeah. Laura, the question was, do vaccinated performers have to be 10 feet apart?
So if they're all vaccinated, they're not going to give each other COVID, right? So you don't have to worry about that. If we were all in the same, if all the performers are in the same room and every performer is vaccinated, they're not going to give each other COVID. If there's half the performers are vaccinated and half aren't, there's still small risk that somebody who's vaccinated could spread it to somebody who's not. So that's what I would think about is, are they all vaccinated or not?
Great. And I can also tell you a lot of the Broadway touring shows are planning to vaccinate their entire casts as a requirement. So equity must be on board with that. The Actors Union must be on board with that. Would outdoor pavilions with sides or tents with walls be considered safe for performers?
Outdoor pavilions with sides or tents with walls. So I guess the question is there air circulation?
Right.
Or the same as a room? If you can get some air circulation in there, it's better. The more air, the better.
Got it.
Right.
Question. I think this is a question. The rock and roll band outside, concerts, dance floor. I think the question is, can you have one?
Well, the answer is, I can't wait.
But dance floors, people together, probably not. Yeah, Laura?
But I will say this, probably not. But I do think by summer, it's okay to require a proof of vaccine or proof of a negative COVID test. If everybody has either been vaccinated or has a negative COVID test and wears a mask, safer.
Right. A real quick comment from Wisconsin Youth Symphony are using the instrument bag. So again, the education music programs are ahead of the game on this. So those are the ones I would check in with. Thanks for that.
The Youth Symphony is also using piddle pads.
Yep. Yes, MISO, another comment. MISO would be able to answer questions about masking for wind instruments again. Maybe a better question for Kendra. Thoughts on requiring guests? Oh, this is a good one. Thoughts on requiring guests to be vaccinated before attending events? Too much? A nightmare to manage? It's not a crazy question, Jackie. This is absolutely something that's being discussed right now. We have been talking. Oh, go ahead. Someone have a, Laura, were you gonna?
Oh, no, this is one of my favorite topics.
Yes, go ahead.
I think it's controversial, but in my opinion, it's a good idea. Excuse me, because there's some ethical things like who can't get vaccinated. But first of all, it drives behavior, especially in our younger population. If you can't go to a sporting event unless you're vaccinated, well, it's easier to go get a shot than get a nasal swab, So there are some people who have ethical considerations about it, but if it's your event, you can require that. And Ticketmaster is partnering with Clear and others to have apps that when you buy a ticket, you either show proof of a vaccine or you show proof of a negative test within 24 hours. And then Epic and Cerner and all the major electronic health records are teaming up with technology to do this. And I personally think this is the way it's going to go. And like I said, when I go to Africa, I have to show a proof of a yellow fever vaccine or I can't go in. It's one thing, you have a choice whether or not you want to get a vaccine, but if it's a deadly virus, to bring that into a venue, that's a different choice. So this is something I'm an advocate for, and I think it's the way things are going to move, because I don't think COVID is just going to go away. I think it'll mutate, and every year there'll be a vaccine. And so this may even be required, for airplanes. Airplanes are now, now it's required to test, right? When you're coming to the United States from another country. I don't know why it's not required within the country. But, these things evolve. And so Kendra, from your perspective with your theater.
Definitely, we're considering it. And I can tell you at the national conversation in Broadway, absolutely talking about it. As a matter of fact, our Broadway partners were the ones to tell us about the innovation that's happening with Ticketmaster and Clear. So I absolutely expect that this will be required at least for large venues going forward. And if not vaccination, for sure testing results. And that there was a great success story that many of you may have heard about, the Phantom of the Opera production in South Korea that did not close during the entire pandemic. Now, again, there's a level of the culture there is much more accepting of compliance than maybe in the United States, but in order to get into the show, you had to show your testing, your test results. That's how they were able to have full capacity Phantom of the Opera during the heat of the pandemic. So yeah, 100% think this is the way things are going. Sorry, go ahead.
So Kendra, I'm sorry to interrupt, but I just want to say it is 9:57. And I mean, we can go for as long as you want, and people can stay on for as long as you want, but maybe we should answer these two more questions, and then you can talk about the SBO, SFOG, whatever you want to call it.
Yes, absolutely.
We'll,
Sorry. Thank you
then
for
we'll have
time.
the recording afterwards.
Great. Thank you for the time, because Laura and I actually do have a 10 o'clock together. So what about, we're hearing about the uncertainty of vaccinated people being inadvertent spreaders. What about, let me just read this again. What about what we're hearing about uncertainty of whether vaccinated people can be inadvertent spreaders?
Right. So the vaccine trials, this was an emergency, a worldwide emergency. So the vaccine trials were created to test whether the vaccine stopped people from getting sick, stopped them from getting very sick where they needed hospitalization and could potentially die. So they're very effective in preventing symptomatic disease. So people aren't getting, the majority of people who get the vaccine do not get sick at all. But they weren't designed to test whether they could still carry it or whether they had asymptomatic. And again, there's certain types of antibodies inside our body that fight the virus. And then there's different kinds in our mucosal lining in our nose and respiratory system that fight it. So that's how it gets into our system. So it may get in through our nose and we may have some virus in our nose, but then our body says, boom, we're not going to get sick. So what they're studying now is, can you still shed that from your nose and spread it to somebody? And so they're studying that now, but we weren't going to wait to get the vaccine out. And if everybody's vaccinated, or the majority of people are, then we're in a position where we're normal. I mean, people are always going to get sick, but we just can't have this like overwhelming number of deaths. And so there are some studies in Israel. Israel's vaccinated 30% of their population. They're the most aggressive, and very few. They're now doing serial PCR testing on people to determine on large scale. I think they've tested 200,000 people. So the results are promising, but we're cautious.
Right. And I think I'll end on this question. Am I hearing this correctly? If all goes well, by fall, things may be relatively normal and indoor events can start up again. And by normal, thinking of acting in characters, close proximity, audience close. And you keep saying best case scenario. When do you anticipate knowing we are in best case? Laura?
In September. No.
Oh, Laura.
We only know, when it's a prediction, then you can hang my head. But we only know. No, what we need, hospitals functioning at normal capacity, and normal is 60 to 65% full. They're about 80% full now. When they were critical, they were 89% full, and then we can't take care of people. And we want to see low case rates. So when the percent of people who test positive is under 5%, and we have high rates of vaccination. So we do think we'll get there this summer because there are many people eager to take the vaccine. And the vaccine supplies will ramp up. We'll get new ones approved. The only thing that'll hold us back is if there are people resistant to taking the vaccine. So if half the people don't want to take the vaccine, then we're still going to have safety measures in place. But I really think that the more people that get vaccinated, others will see that it's safe and they'll see that it's effective. And hopefully that won't be an issue. So I think, if you want me to give you a date, I would say by April, I think we'll be opening up vaccines, April, May, to the general population. And then we'll have an idea of the number of people taking it, and we'll see where the rates are.
Thank you, Laura. And
That's a
I
good
think we
place
got
to
through
end.
most of the questions. I'm going to do just a real quick Save Our Stages SBOG grant. For those of you, I know a lot of you on this call are potentially eligible for shutter venue operator grants that are going to be coming out through the SBA. I put in the chat the latest and greatest, hot off the presses yesterday, guidelines or FAQs from SBA, answering a lot of the questions we've been having over the last 3 weeks about what's included in the grant program. So I'd strongly encourage you to take a look at that, particularly some really good answers to questions on earned revenue and membership fees, et cetera, et cetera. And every day they're getting guidance from a number of the partners, Broadway League, NEVA, on additional questions that membership is asking. So please take a look at that. And I would also encourage you, I'm going to put in the chat for venue operators, NEVA is an amazing resource. I have to say they have been a great great at getting the word out, particularly to small venues in rural communities that might not have as many resources. So definitely check out NEVA. Membership is free right now, and might be a great way to just stay in touch on what's happening with the grant, because they are pushing it out faster than I can read it. So I just wanted to share that little bit of update and make sure everyone saw that, because the SBA guidelines, you have to look at that website almost every day in order to keep up on what's going on. But thank you, Laura, so much. I cannot tell you how grateful we are for you in this last year. And
I'm
thank
so
you,
grateful
Andy,
you were on
Karen.
the call with me, because you know as much as I do.
No. I am not an expert, as I say, I'm not an expert.
Thank you both. And thank you to the Arts Board for partnering on this. We have the recording. We will get as many of these links and resources together as we can and just blast it out like crazy. If your question didn't get answered or you come up with another one, send it to me. I'm going to put my my email in the chat box, and we'll just keep trying to answer the questions as much as we can, as fast as we can. As Kendra said, the information changes every day, but thank you all for your great work. Thank you again, Laura and Kendra and Karen, for working for this effort, and be well.
Take
all.
care.
Yes,
Thanks.
thanks so much. Care.
Thanks.